All right, so now that we have like a basic on the process of surveying, what surveying is, and what are the different types of retainers that we can use, what are the various components in a cast partial denture, let's go about actually looking at a live case and how our brains are supposed to work when we look at a case and we go about treatment planning. Now, as you look at this case, you notice that it is a Kennedy class 3 because it has teeth on both the anterior and the posterior, or the mesial and distal. And of course, it is going to be a modification 1, right? Considering which space you consider to be the modification space. Kind of really doesn't matter. And one of the other first things that you notice is that there is a lingually placed lateral incisor there, which would either have to be plated or in a better case scenario be extracted so that we can go about our rehabilitative process. Now let's look at a step by step of how basically we are going to assess the path of insertion of this particular case. What happens when we try to change the tilt of the cast in an attempt to relatively change the undercuts, and of course the process of blocking out. Right. So if you look at this case, we have the receipts nicely prepared on the abutment teeth, which are the premolars and the molars, right? And I told you that we're going to be extracting that lateral, which is going to interfere with whatever mandibular major connector that we choose to give. Now, plating would be a good option, but then it would be a little troublesome for the technician to actually wrap the lingual plate around that particular tooth. So I go about and decide to extract it. Now, since I'm working with the software, I digitally extract it. The doctor can extract it in the patient's mouth, and the work can proceed side by side. Now, this is basically a look at the surveying tool in the software. The thin vertical line is basically the true vertical axis, right? And the solid blue line is the software determined path of insertion. Now, in simple terms, the path of insertion simply means that that is the direction in which the CPD is going to sit, and that is the direction in which the CPD is going to come out of the patient's mouth. Now, you notice that the teeth have a slight tilt, right? And you would have often noticed in your temporary partial denture cases, post processing, your TPD never really fits. You have to do some kind of trimming and adjustments for it to be able to go and sit inside with a click and come out comfortably. Now, that is because your TPD engages all the undercuts that is there in the mouth. Now, with 3PD, since it is acrylic, you can actually go about and adjust it. But with the cast partial denture, it is completely in metal. That is not possible. That is exactly why we need a surveying process and to determine the path of insertion. Now, if you notice, there on the right is a red bar that shows the varying level of undercuts. Now, in this particular tilt, you can see that on the dark red areas, there are undercuts that are beyond 0.75, which we basically don't need. And undercuts in the orange and amber are the 0.25 and the 0.5 range, which is basically what we're going to be using, typically the ones in the orange range. Right now, you can see as I'm varying the path of insertion, which is basically the solid red line that is changing, the relative position of the undercuts keep changing. But my aim is to basically make sure that the CPD sits in as vertical a fashion and as vertical a fashion of removal as possible. I don't want the patient to be tilting their head or tilting the CPD too much in order to be to be able to seat it. And practically speaking, more than 10 degrees of tilt of a patient's mouth or the prosthesis is not possible clinically, and that is why we choose as straight a path of insertion as possible. And if the tooth contours are unfavorable, we would prefer to slightly reshape them. Now, once I have a amount of path of insertion that is kind of a good undercut for all the abutment teeth that I use, I go about with the block out process. The software automatically blocks out all the undercuts that is present in the software. Now, this is of course arbitrary blocking out. That is what you see in the anterior teeth. And if you notice in the region where the proximal plates are going to be present, the blockouts are automatically straightened out according to the path of insertion. That is basically what your parallel blockout is. Now, for the areas where the clasps are going to be present, I will use a tool to scrape away a layer of wax, which is basically what I'm doing right now, and that is known as the shaped blockout. So arbitrary blockout, which is basically blocking out all the areas that are not needed. Parallel blockout, which is what you see in the proximal aspects. And finally, a shape blockout, which is where only the tips of my direct retainers are going to come. And this is how you do a surveying and a blockout process for a case.